I would like now to hand over to the Honourable Geoff Wilson, who's our current Minister for Health.
Well, good afternoon everyone, and thank you Sally, and thank you Beth and to the QNU for organising this forum. Can I firstly acknowledge the traditional owners of the land upon which we meet, and secondly recognise all of the women of today and of the generations past as we celebrate International Women's Day. And what better day to be having an event auspiced by the Queensland Nurses Union than International Women's Day, and I suspect it wasn't an accident. Ladies and gentlemen, nurses are at the heart of our healthcare system in Queensland, and across the state we are working hard to deliver more services sooner and closer to home for Queenslanders. Nurses, frankly, are the backbone of our health system and of the mission that we pursue. So I wanted to commence this afternoon by saying, on behalf of the government, thank you for the work that you do. On behalf of the government, on behalf of every person who has either received first-class, world-class treatment in our public hospitals or anticipates to do so. Protecting Queensland's nurses, protecting their jobs and protecting their conditions and protecting their safety at work is a passion for this government, which we share with the Queensland Nurses Union. The government is committed to working with the QNU to deliver real wage growth for Queensland nurses, and if re-elected, we undertake to deliver EBA 8 in the first 100 days of the new Bligh Labor government. I know we have points in that negotiation where we don't see eye to eye. It is an EBA negotiation after all. But I can assure you that up to this point we have been working very, very hard to resolve those issues in good faith so that we can ultimately deliver an agreement. We're focused on the future of nursing. The government believes that this is the significant contrast between what we have been doing and what we propose to do and the alternative through the opposition. One of the most glaring issues for this government, we believe, is making sure that we craft the future around a vision for nursing as a profession, a fully fledged profession within Queensland. Just yesterday, as part of the launch of Anna Bligh's new men's health policy, we have committed to providing 12 nurses who will be dedicated to prostate care and the testing and treatment of prostate cancer. This, I underline, is a pilot to look at how we may do this and roll it out across the state using really the unprecedented example of what we do, what you do so well in addressing breast cancer and the treatment of breast cancer. We're also delivering on nurse-led discharge. It means nurses making tough clinical decisions, working with patients towards getting them back on their feet and back home sooner. One of our proudest achievements, opposed, I must say, by our opponents, was the creation of nurse practitioners. And I'm proud to say that as a result of the Bligh government's commitment, Queensland has the fastest growth rate in the number of nurse practitioners working on the front line. What's more, nurse practitioners in Queensland now have the authority to prescribe medication, enhancing their capacity to provide greater health care to more Queenslanders. This is fantastic for nurses as it builds a new career path for them, but also for Queensland patients who most stand to benefit from the world-class care that they will provide. One of the surest ways we can protect nurses in Queensland is pretty simple, actually, to hire more of them. At the last election, the government put forward a target to increase the health workforce by a further 3,500 nurses, doctors and allied health professionals. Well, as of January this year, we had employed 6,600 additional clinical staff, the overwhelming number of those being nurses. So the government sets goals and we endeavour to exceed them. I must mention, of course, that I do really understand that the staff have been and many remain angry about the failure of the payroll system, and rightly so, and I again want to apologise to staff for this and the pain that it has caused. as a former trade union official who has worked with and for workers across many industries across Queensland, nothing rankles me more than that. So I can't stress enough that the government takes the responsibility that it does have to treat its employees decently and to ensure they receive every cent of their wages and entitlements on time and accurate. Getting all of this right will take time, but I give you my commitment that we will work tirelessly until the job is done. I want to also, in that regard, acknowledge the splendid role that the QNU, very vigorous role I should say, the QNU has undertaken in representing members' interests in that regard. So ladies and gentlemen, we are committed to building the profession of nursing and midwifery here in Queensland and doing everything that we absolutely can with an unprecedented budget in rolling out more and more opportunities for nurses and midwives in our public health system and the health system more broadly across Queensland. Thank you very much.
Thank you, Geoff.